and we'll then talk strategy. So behavioral activation was basically developed to treat depression. However, it's relevant for many, many other issues. First of all, with the DSM-5, we have these very explicit categories. You're anxious, you're depressed, you have PTSD, but people tend to have difficulties. And depression is a component of many, many people's difficulties, even if they don't meet the criteria for a diagnosis. So I find I use behavioral activation all the time. And I don't know about you, but I think in times of COVID, I think I'm using behavioral activation with absolutely everyone, as we're all lethargic and somewhat depressed. So what's the theory behind behavioral activation? It's basic CBT theory. And what CBT says is you have a situation, a difficult situation, which is causing you stress. And you want to understand this situation in terms of your feelings, your thoughts and images, your physical reaction, and your behavior. So let's take depression. You're feeling down, blue, maybe a bit irritated and anxious. Your thoughts are probably something like, no one likes me, I'm a failure, nothing will ever work out. You're most likely extremely tired. You may eat more or eat less. And what you do typically when you're depressed is you withdraw from life. You engage less with other people. You tend to rest more, hoping that you'll feel better, but you don't. Rest when you're depressed doesn't help you feel better. You give up on a lot of activities because things just seem too hard. And if you're really depressed, you may be staying in bed all day. The theory in CBT is that you can start to parse out your feelings separate from your thoughts and images, physical reactions, and behavior. And even though you can look at them all separately, because as you see all these arrows, they all interact. So that's the basic CBT theory. What it says is that you can intervene at any of these factors, and it will influence and affect the entire system. So the question for us as therapists is, where do we want to intervene? And it's a lot easier to intervene at the behavioral level than at the feelings level. Very hard. How do you feel better? I mean, you can't just say, I'm depressed, let me feel better. Thoughts and images. There are a lot of CBT techniques to help people modify their thoughts. But if you're very depressed, it's very hard to access those techniques. We don't have a lot of interventions for physical reactions, but it's relatively easier to intervene at the behavioral level. So let's take a bit of a deeper dive at behavior and its relationship to feelings. The basic idea is your actions affect your feelings, and your feelings affect your behavior. So when you're feeling depressed, hopeless, tired, lethargic, and you withdraw from activities that bring you meaning and pleasure, you see family and friends less physical activities. What you do when you're depressed is you avoid your problems, but you think about them a lot, you ruminate. Your feelings lead to all these behaviors of avoidance and withdrawal. But when you avoid your problems and you withdraw from your life, you also feel terrible. So you're caught in a real vicious cycle. And the more you withdraw, the more depressed you become. And the more you withdraw, the more you amplify your current problem. So let's say your boss was a bit irritated with you. You're sometimes late, sometimes you procrastinate. Because you're depressed, you procrastinate even more. His irritation increases and you get even more stress at work. The power of behavioral activation is what it says is that despite your history, Depression is maintained by your current behavior. And this is really an extremely hopeful way of seeing behavior and of seeing therapy. Because what it says is, despite a really difficult childhood, despite a history of depression, we can take a look at how you're currently behaving. We can take a look at what you're currently doing in your life. And if we can help you have a better life, you can feel better. So it's a very practical approach, but also a very, very hopeful approach. Because basically, when you change what people do, you're going to change how they feel.